All right, we're going to talk about facelift. And when people talk or say facelift, they have certain ideas in their mind. What does that include? There are plenty of procedures that are done in conjunction with a facelift, and we're not going to talk about those. And some of those things include fixing the eyebrows. We do like an endoscopic brow lift that elevate the eyebrows and working on the eyelids, blepharoplasty, okay? But when people think about a facelift, they think improving the cheeks, the lower face, and the neck, okay? And in fact, a standard facelift is just that. It's an incision typically in front of the ear, up into the hairline, behind the ear, and then back into the hairline. And that's gonna lift your cheek, fix your nasolabial folds, fix the corner of your mouth, fix the jowls, okay? And then also fix the neck. It's gonna pull the neck skin tight, so it's gonna give you a more acute angle in your neck instead of having that obtuse or heavy neck. Okay? So other facelift procedures that people talk or ask about is so-called short scar or mini facelift or a neck lift. Well, what are those? Remember, the facelift is the incision in front of the ears and behind the ear. A short scar facelift is just in front of the ear, and as you could imagine, that addresses your cheek and the lower face. A neck lift is that portion of the incision that is behind your ear and that addresses the neck. So as you can see, a neck lift plus a short scar facelift is a facelift. So a neck lift is part of a facelift. A short scar facelift is part of a facelift. Things that are commonly done with facelift surgery is not just removing skin, it's also tightening the deeper layer, what they call the SMAS. Okay? And when we age, we lose volume in our face. So our face, which is in youth triangular, becomes rectangular because we lose facial fat in the upper face, and we replace that as part of a facelift. You think about things in 3 dimensions. So adding fat grafts is a very common thing that's done with the facelift. Like we talked about earlier, addressing the eyebrows or the eyelids is commonly done. Another thing that may be done is if you have either a lot of fatty tissue underneath the neck, we may be able to treat that with liposuction. Sometimes if you have those 2 bands that run in the front of your neck, that may be treated with a submental incision and what's called a platysmoplasty. We actually sew those muscles together to give a nice shape, almost like a hammock kind of shape to the neck. If you're interested in these types of procedure, there's a lot of details. Love to discuss them with you.